Welcome to Goal Getter, the AAP Physiotherapy podcast. My name is Jen Panteluk, and I'm the CEO of the Alberta Association of Physiotherapy. This show explores the power of physiotherapy, helping individuals move, heal, and thrive. Let's get moving. I'm really excited to welcome Dr. Catherine Schneider to the show today to dive into the world of concussion. I think it's an area that we don't talk enough about, but it is so important for everyone to understand a little bit more around it. So, Catherine, welcome.
Thanks so much, Jen. I'm really excited to be on the show today and to chat about a topic that is one of my favorite.
So, to kick us off, would you mind sharing a little bit about your background information in physiotherapy and specifically with concussions?
Yeah, for sure. So I graduated from physio school from McMaster in 1998 and worked in Ontario for about a year until my husband Jeff graduated. And then we moved out to Alberta and I worked in a sport medicine and sport physiotherapy clinic and did some additional training in vestibular rehabilitation and then did my manual therapy levels and my part A's and part B's. And in that process, I also worked with a number of different sports teams. And one of the sport medicine physicians that I worked with it was around 2000 had asked me, Kath, can you see one of my players that's been out for about a year and he just doesn't seem to be recovering from his concussion? And that's back in the day when rest is best and people just kept on resting after a concussion and didn't follow an active process of recovery. And so I said, sure. And I took a look at him, and he had some findings in his upper neck and had some altered motor control, as well as a hypomobility and at C12. And then he also had findings consistent with the peripheral vestibular hypofunction. And so I saw him a couple of times, and he got better quite quickly and was able to then complete the return to play protocol, as it was termed then. And then I started to see more and more athletes with these types of symptoms. And so I was asked in 2008, I was invited to come to the University of Calgary Sport Medicine Center clinical rounds and present some of the cases that I was working with. And again, the rationale still then was, well, with concussions, we need to just keep resting. So I presented these cases and talked about the combining of cervical spine treatment and vestibular rehabilitation with an active exercise-based approach. And I had a great conversation with Dr. Winame Wissa, who's a sport and exercise medicine physician and epidemiologist that works a lot in the area of concussion internationally. And that conversation turned into him asking if I was interested in testing some of the hypotheses that I had and some of what I was seeing in the clinic. So that turned into me doing a PhD. And this was one of the main studies that we did was a randomized control trial where we compared the typical protocol of rest followed by gradual exertion to a combination of cervical and vestibular rehabilitation, as well as the protocol of gradually reintroducing activity. We saw that the people that we treated were 10.27 times more likely to be medically cleared to return to sport within an 8-week time period. And so it was quite actually a very strong relationship. So it was quite exciting. And then I was subsequently invited to present some of the work that we had done at the fourth consensus conference on concussion in sport. And then I, since then, have had the opportunity to lead the methodology for the fifth international conference and sixth international conference on concussion in sport. And I've led the rehabilitation systematic reviews and portion of the international consensus statements. And most recently, I had the pleasure of co leading the Amsterdam International Consensus on Concussion in Sport, which was from the sixth International Conference on Concussion in Sport. So it's not an area that I thought, wow, I want to go into concussion research, but it's a pathway that I've ended up taking. And I feel really, really fortunate for all the mentorship that I've had along the way and all the great colleagues that I've had the chance to learn from.
That's fantastic and such important work being done as well all along. So, for those that maybe aren't as familiar, could you talk a little bit about what exactly is a concussion and how does it affect the body and the brain?
Yeah, that's a great question. So, A concussion is a type of brain injury, and it happens when there's a blow to the face, head, or body with force transmitted to the head. So there's a plausible mechanism of injury. And that's followed by symptoms and or signs. And so the most commonly occurring symptoms are headache and dizziness. And some of the signs could be that a player lays motionless for moments on the field of play. They might clutch or grab their head, be disorientated. And it's thought to be a transient change in neurological function secondary to the trauma. And the symptoms typically resolve in a sequential fashion over days to weeks following injury, but up to 30% of individuals may have symptoms that actually last more than 30 days. So, really important to, assess and treat, because that initial detection and recognition of concussion will also remove an athlete from an at-risk situation. So there's not a risk of a subsequent blow to the head.
Are there sports that you find carry a higher risk for an incidence of concussion than others?
Yeah. So if you look across the literature, contact and collision sports have the highest risk of concussion. And typically, risk of concussion is higher in games than it is in training or practice. So, among the sports that have the highest risk of concussion include rugby, American, Canadian football, ice hockey. So, where there's that contact collision component. And rodeo, actually, if you look at time spent doing the sport, has the highest risk because the exposure time or the exposure to sport is so short.
Oh, okay, interesting. So you were saying earlier, and I think it's something that people often associate with concussions, that rest is best, but obviously research has proven otherwise, and that there are other things that should be incorporated into that recovery piece. Could you talk a little bit about how
Mhm.
physiotherapy fits into the recovery process with concussion?
Yeah, absolutely. So, this is really where physiotherapists can play a really important role. So, it used to be that prolonged rest was recommended. And there's actually research now to show that an initial period of just 24 to 48 hours of relative rest, so decreasing cognitive and physical demands, is what we recommend now based on the current state of the literature. Reduction in screen time is just for that first 48 hours. And after that time, the screen time component doesn't seem to be as much of a predictor of recovery, but that initial 24 to 48 hours is important. And then the recommendations and what the research literature shows is that aerobic exercise, symptom tolerated aerobic exercise, can facilitate recovery starting as early as 2 days post injury. And the general parameters are that as long as symptoms aren't increased more than 2 points and they go away within an hour, then that's the area that you're looking at and training at 80 to 90% of that symptom tolerated threshold. There's also research, as I mentioned earlier, about combining cervical and vestibular
Mhm.
rehabilitation. And so combining symptom tolerated aerobic exercise with cervical and vestibular rehabilitation is also recommended. And typically, that can start around 5 to 10 days or 2 weeks post injury. There's a little bit of debate around if most individuals recover in that early time period, then how early do you need to start treatment? But then there's also some emerging literature that perhaps earlier is better. So we don't know the optimal time to start treatment, but generally, if we pull from some of the other literature, between that 5 days and 2 weeks is likely the optimum time, but this requires further research. And physios can also be a really important part of the interdisciplinary team and help facilitate referral and collaboration with other healthcare professionals. So, really important to also think that, there's other systems that can be involved in a concussion, such as vision. There's also a number of different, psychological components around depression, anxiety, sometimes the stress that comes along with this. So, collaborating with psychologists and neuropsychologists in this area and thinking about other areas where perhaps referral to a physician specialist for further evaluation in other areas could be really important. So, thinking about how that interdisciplinary team interacts is also really important. And most people don't need to see every single healthcare discipline initially. However, especially when symptoms persist after you've treated your patient for 4 to 6 weeks, it's really important to think about, could there be something else going on here that perhaps is really important to facilitate recovery?
So you mentioned that some people recover, like not knowing in terms of like the timing to start treatment. Some people recover early
Mhm.
on. Is it recommended that, say, by day 5, you're like, I think I feel okay, that you get assessed to make sure that you don't need further treatment? How does someone know that they should seek further treatment for their concussion?
Right, that's a great question. So, in some cases, the symptoms will persist. So, perhaps some new symptoms. As we know, the symptoms related to concussion are non-specific. So, there's other reasons you could have a headache. There's other reasons you could be dizzy or have neck pain or difficulties thinking. So, important to think about what are the concussion related symptoms and how are those different. But actually, there's some research that shows that even when symptoms are gone, you could still have ongoing physiological problems or impairments. So, that's why the initial period of rehab and returning to activity. We term that the return to sport strategy steps 1 to 3. And in our latest consensus, we term the first 3 steps the treatment stage. And that's where it's okay to have these symptoms because we want to facilitate sensory motor reintegration and facilitate returning to activity. And that has to be done away from any risk of another head impact. So, any risk of contact collision or fall. After that third step, if all concussion related symptoms are gone at rest and with physical exertion, then the individual can progress to a follow up appointment where you would be assessed for symptoms as well as a clinical evaluation to ensure that there are no ongoing problems that might suggest that your body's not quite recovered yet. And after you receive that clearance, then following the return to sport, final 3 steps, so steps 4 to 6 of the return to sport strategy can be initiated. But really important to have that assessment in case there's ongoing problems that don't necessarily have symptoms with before you return to any at risk activities.
Right. So just because your symptoms disappear quickly doesn't mean you're quite fully recovered. And doing that check is really
Exactly.
important. In the work that you've been doing, you probably hear a lot of myths about concussion, or like from
Mhm.
athletes or from the general public. What are some of those biggest myths that you tend to hear on an ongoing basis that you really want to change the conversation around?
Oh, yes. I think this is a great topic. I often will have a Mythbusters section when I do a presentation, and it really engages the audience because there's often things that you're like, oh, yeah, I'm not actually sure. So, one is that, you know, less and less people believe this now, but used to be everyone has to lose consciousness. If you don't lose consciousness, you haven't had a concussion. And that's actually not true. Only about 8%, 7 to 8% of individuals will lose consciousness when we look at large samples that are incident samples. So, of everyone that sustains a concussion, only a very small proportion will have lost consciousness. So that's one really important piece to think about. Another myth is that you need to not do anything until your symptoms are gone. And I think we're doing a good job of now promoting more of an active and integrated process to returning to activities. But it's okay to do activities, cognitive, so thinking activities as well as physical, when you still have symptoms. The general recommendations are if your symptoms are at a 6 or a 7 out of 10 on an overall condition scale, then you probably want to still take it easy and just gradually reintroduce your activities of daily living. But if they're below that, you can use that principle I mentioned earlier of symptom tolerated. And that's where only a 2 point increase in your symptoms is okay. Above those 2 points, then that's too much. You need to back off a little bit. But having that active approach actually helps with recovery. and helps facilitate recovery. Whereas before it was thought that no, you can't do that because you're damaging your brain. But actually, the research supports that no, you need to get more active. And it's very similar to what we do in all the other conditions that we treat from a physiotherapy standpoint. So, very in line with principles of rehab.
If someone experiences a concussion, do they always have symptoms?
Typically, people will have symptoms, but sometimes they're very short lived, and oftentimes there are signs as well. So, even if the symptoms are short lived, then even though they go away quickly,
Mhm.
they still have likely sustained a concussion.
This in mind, I'm just thinking about myself as a parent. If, one of our kids were playing sports, maybe got hit in the head, but didn't seem to be off or complain of any symptoms, when do I know as a parent if I should go get them assessed?
So that is an excellent question. And this is sometimes tricky to know. A general rule of thumb is when in doubt, sit them out. So if you're not sure, better to err on the side of caution. But sometimes, especially with younger children, they might not experience their symptoms in the same way or describe things in the same way. So if they're more irritable, or sometimes instead of saying they're dizzy, they might say, "Ooh, my tummy doesn't feel good," or they might describe things differently than an older child might. And so, asking questions around how they feel may or may not give you the answer that really gives you a good direction. So, if you're concerned at all, or you see their behaviors out of the ordinary, or you think that something may have gone on where they could have sustained a concussion, it's a good idea to get checked. And then signs of something more severe or more severe type of brain injury where there's a constant unrelenting headache continues to increase, or they are looking more unsteady or reporting double vision, those kind of things are more urgent. And that's when you would want to go to urgent care. We designed a tool called the concussion recognition tool, and it's meant to be used by the general public. And it takes you through a step-by-step process to think about, could a concussion have been sustained? And then it gives you some recommendations for actions based on how you work through this tool, essentially. And so using the tool actually is a great way to look and see, do you or don't you need to take your child in for further follow-up. And we also actually we had a lot of, when we did some work evaluating how these concussion protocols were being implemented across the national sport organizations and at the grassroots level, across all levels, people said it would be really helpful if there was like a training tool that could help us use the concussion recognition tool, because we're not sure if we're using it right. So we actually created a tool that you can go through different scenarios, and it gives you specific examples. And you can find that on the Parachute Canada website. And that would be a great tool to use, especially if you're not sure.
As a parent, if your child sustains a head blow or any sort of trauma, go visit Parachute Canada to access the tool and help you maybe ease your worries a little bit or seek care.
Totally. And Parachute Canada has a lot of great resources. We're lucky in Canada, we have an amazing group of interdisciplinary clinicians and people across different sport body organizations and different sectors that all work together to develop a lot of these tools. And then they've been adapted for different groups. And so you can find lots of different resources on Parachute's website. And that's been developed really over the last 10 years, and they've been evolving over time. So you can find up-to-date resources on that website.
Are there any activities that people should really avoid doing in the early stages of recovery? I know you had mentioned, there's new research showing that a certain amount of aerobic activity is great, reducing screen time for that first 24 to 48 hours. Any other big things that one should avoid during the recovery process?
Yeah, so especially initially, if there's any concussion related symptoms, then avoiding any activities that have a risk of contact, collision, or fall. So thinking through, every everyone does different activities. So thinking about what you do throughout the course of your day and anything that might pose a risk. And really, you want to protect your brain from any subsequent trauma, be it from a fall or from an impact, because the outcomes can be much worse if you sustain a second impact while your brain's already at risk and already vulnerable in that time period. And sometimes worse outcomes can happen, such as persisting symptoms, a worse type of brain injury, and in the worst case, death. So you just really have to be careful in that time period where those symptoms are still present and any signs, because that's when your brain is still recovering.
So you mentioned earlier, just in terms of that gradual return to activity and following the steps along the way. Can you talk a little bit about how a physiotherapist can help guide through that process and make sure that an individual is ready to move on to that next step and that next level?
Yeah, the physiotherapist can be an integral part of the team when looking at progressing through activities. So, depending on how you respond at different levels, the physiotherapist can help you determine the heart rate at which you're supposed to work at from a symptom tolerated aerobic exercise standpoint. The physiotherapist can do assessments across different domains. So, things like the cervical spine, your vestibular system, which is your balance system, your eyes, looking at balance more broadly and different functional activities. And the physiotherapist can assess all these different areas as well as assessing neurological function. So can really help with identifying which areas need to be treated, because concussion is a heterogeneous injury. And what that means is each person has different problems from a concussion. It's not the same for everyone. So identifying the areas that would be important for you to work on, the physiotherapist can help you with that, and also identify targeted goals that meet the activities that you do, because it's really important to work on these different exercises and treatments in a context specific manner, which means doing the things that you love to do and that you want to get back to do, or in some cases need to get back to doing. So really important to have those pieces.
So often people are always looking for a quick fix or a way to do things faster. When it comes to concussions, are there any exercises or therapies that can speed up recovery, or is it one of those you need to be mindful and wait the right amount of time?
It's probably a bit of a combination of the two. So we know it takes time for the brain to heal. And so part of the return to sport strategy and the return to school strategy actually enable 24 hours per step, so a minimum of 7 days. And then from an exercise and from a rehab standpoint, combining cervical and vestibular rehabilitation and aerobic exercise, symptom tolerated aerobic exercise, have been shown to facilitate recovery. So they can help with that process. And the challenge is it also has to be in a way that facilitates recovery from a brain standpoint and ensuring that there's no ongoing other problems that may suggest that your brain hasn't recovered. So sometimes an interdisciplinary team that includes a physician and looking at other areas that might need to be evaluated, looking at psychology and potentially cognitive behavioral therapy, sometimes vision therapy, although the evidence isn't strong for some individuals. If you're having a problem with your eyes following concussion, that can really drive a lot of symptoms as well. So generally what we recommend is that initial period of 24 to 48 hours of rest, then gradually reintroduce activities. If you're not starting to feel quite a bit better as you do that, then looking to see what would some of the targeted treatments be that would be most appropriate based on your symptoms. So sometimes that's cervical and vestibular physiotherapy, so doing physiotherapy in an active approach in combination with symptom-tolerated aerobic exercise. And if your symptoms still aren't turning around, then there's some research to show that integrated and collaborative care, where you work with more of a team of individuals, that can help as well. So a team of different healthcare providers, such as a psychologist, an occupational therapist, and potentially physician specialist or others, could be helpful to get better faster.
So it sounds like it's really important to have regular and ongoing communication with the healthcare practitioners that you're working with to ensure that you're recovering in the best way possible.
Yeah, absolutely. That communication between healthcare professionals is really important. And often, as a physiotherapist, we sometimes are a go between person that helps facilitate that discussion between multiple healthcare professionals. And on the flip side, your physiotherapist might also identify areas where perhaps would be helpful to see someone else to get an opinion and then determine how that might actually help facilitate recovery. Because oftentimes, if you have one system that isn't working as well as it should, then sometimes that can drive some of the other symptoms as well. So really important again for that whole picture and collaborative approach to treating concussions, especially when the symptoms persist for more than a month.
Are there ever instances where symptoms don't ever resolve themselves and someone finds themselves, dealing with symptoms of a concussion for a year or more after the incident took place?
Yeah, so sometimes the symptoms can persist and last for quite a while. In general, most people do have recovery of symptoms, but sometimes those symptoms persist, and that's where it's really important to have that interdisciplinary team approach. In some cases, if you have persisting headaches, it's really important to get an appropriate diagnosis for the type of headaches to then inform the correct type of management. So for instance, migraine headaches, there's a specific process for treatment from a migraine headache standpoint. And if you're just getting treated, say, from a cervical spine standpoint, and actually the migraine requires treatment, then you're not going to have the same results. So really getting to the, underlying driver and the specific diagnosis, and oftentimes combining physiotherapy and medical management can actually really help recovery. But if you're just doing one or the other, sometimes that doesn't help as much. So really being mindful of if those symptoms aren't turning around, thinking about other areas or other individuals to follow up with, and really taking that active approach to rehab.
So an athlete has sustained a concussion. Are there ways that they can reduce their risk of concussion going forward without actually having to step away from the sport that they may love?
Yeah, so ultimately, if you can prevent concussions, then we don't have to worry about managing them. So that would be the best if we can prevent concussions, because we all know that everyone wants to play the sports that they love and go to do the activities that they enjoy to do throughout the day. So there are some strategies that can be used to prevent concussions. So neuromuscular training, or combining a series of different exercises that work on control of the body, proper hip, knee, ankle alignment, balance, strength, and aerobic exercise together with and without head on neck control has been shown to reduce the risk of concussion in male youth playing rugby and in adults playing rugby. And there is really good research that actually shows that these neuromuscular training strategies reduce the risk of lower extremity injuries by about 70%, as long as you do it 3 times a week. And the estimates so far in concussion are about a 60% reduction in concussion risk, which is pretty substantial. So neuromuscular training could be something that you may want to consider in terms of prevention. And you can look on the Sport Injury Prevention Research Center website, or it's SIPRC, SIPRC.ca, and go to the resources section, and you can find examples of sport-specific neuromuscular training programs can be applied. Different rules and policy changes can be helpful. So rules that disallow body checking in youth ice hockey have been shown to reduce the risk of concussion. So different type of protective equipment in different sports has been shown to be protective as well. So you really want to think about all the different pieces that would be important to do to prevent concussions. But yes, concussions are preventable, and we might not be able to prevent every concussion, but if we can reduce the risk, that would be so fantastic, because then it saves a lot of symptoms and suffering that individuals might have.
Yeah, those percentages you shared are quite incredible, like terms of the risk reduction. I'm just
Mm-hmm.
thinking like putting, say, like a coach's hat on. how do we educate coaches out there to maybe look at doing neuromuscular training with their athletes in, those high risk sports?
Yeah, so great question. And yes, the more coaches that are aware of and can implement these strategies, the better. So there's a few different ways. I had the pleasure of working with the Coaching Association of Canada recently to update their Making Headway, which is the concussion education for coaches. So you can get lots of detail around neuromuscular training. And there's actually a couple of active exercises on neuromuscular training and other prevention strategies that we have built into the Making Headway. So if you're a coach and you haven't yet done the updated Making Headway, it was launched in May of 2024. It's probably a good idea to go in and take a look because we've updated all the recommendations in this module. There's also Concussion Awareness and Training Tool, or the CAT. There is a coach-specific training module. It takes about an hour that you can do. There's also little training sessions that you can do, again, taking an hour that are developed for youth, that have been developed for healthcare professionals, for teachers, for multiple different stakeholders. So you can give a look at the CAT website as well. And we also have a massive open online course on concussion that I've had the pleasure of developing with my colleague, Dr. Pierre Frémont from the Université Laval. And we're actually launching the next version of the MOOC on April 28th. So you can go online and register for that course as well. And as I said, it'll start on April 28th. It's free. It's openly accessible. And especially if you want to develop a protocol for your sport or have help with facilitating implementation, we have a process where individuals reflect and develop protocols within the MOOC as well. And we have over 40 individuals that have contributed to the MOOC. So you get to hear from a lot of different people with a lot of applied examples. So if you're interested in this area, the MOOC would be a great course for you to take that you can register for.
That's fantastic. I love that there's so many resources that are easily accessible and available to better educate everyone around concussion and prevention, especially the prevention piece. I feel like that's such a piece that we miss. We are such a reactive society sometimes, and we don't think about how can we prevent this from happening in the first place.
Oh, totally. And I think that prevention is one area that's come a long way in the last 20 years. And my colleague, Dr. Carolyn Emery, who's also a physiotherapist, has really been a pioneer in this area. And she's led a lot of amazing research projects that have actually led to significant learnings and then changes to facilitate safer sport for participants. And I think that's it's been an incredible impact on sport overall from a prevention standpoint.
When it comes to concussions, are there any long-term impacts of repeated concussions that an individual should be aware of as they're making decisions and maybe not being as preventative as they could be?
Yeah, so that's another ongoing area of discussion and debate. We don't really know the specific potential long-term consequences of concussion. The current research has some limitations in terms of the way that different factors that are known to affect long-term health have been included within the current research. So there's definitely a lot of research to be done in this area because it's so important in terms of optimizing long-term brain health. If we look at what the current literature does show to date in amateur athletes, there's no increase in risk of psychological problems, depression, suicide, or neurodegenerative brain disease in amateur athletes. There may be an increased risk in neurodegenerative diseases in former professional soccer or football players and in American football players. But again, there's limited research, and in many cases, there hasn't been evidence or there haven't been measures included that actually measure some of the factors that are related to longer term brain health. So this is a huge area of priority that we really do need more research in, and research that's done really comprehensively so that we can properly understand the answer to this question. Because ultimately we really want to know what that risk might be And the research around potential long-term effects really, so far, it hasn't been associated with concussion, but more exposure to repetitive head impacts. So many sports have looked at modifying training rules, etc., to decrease the risk of unnecessary impacts to the head.
Any advice that you'd give to parents, coaches, athletes themselves about recognizing and addressing concussions? You've given us like great wealth of knowledge already, but anything else that you think is really important?
Yeah, a couple of things would be really important to recognize if you have sustained a potential concussion, or if your child has. And the outcomes actually show that early recognition can act, and early management can actually facilitate recovery. And in some cases, there's a little bit of research that shows that if you continue to play, you might take longer to recover. And there's also research to show that if you get in early to a healthcare professional and get doing the appropriate management strategies, that can also facilitate a faster recovery. So appropriate management can help you get back to sport faster. So I think that's a really important point, and ultimately optimizes the safety around potential for more severe injury, which, while it being very, very, very rare, it still is a possibility. And so I think that detection and early recognition and management is really important. A lot of the time, having a preseason discussion and understanding what concussion processes are within sport so that everyone's clear on roles and responsibilities is a really important piece as well.
What advice would you give to an athlete who may be considering quitting a sport or moving on after sustaining maybe one or a number of concussions?
I think something to think about is the fact that decisions around retirement are really good to have with your healthcare professional, but it should be a shared decision. And having discussions around the different risks, the risk of repeat concussion. We know that a previous history of concussion increases your risk of a future concussion, and also increases risk of a musculoskeletal injury. But we also know that there's so many incredible benefits to sport participation, and from a short-term and a long-term, physical, mental, social, etc. So really, really important when we're thinking about these decisions is, are there other sports that perhaps have a lower risk that maybe could be another sport that you could consider participating in if you're choosing to retire from a higher risk sport? Because the benefits of physical activity are massive. Exercise is medicine. We hear that term a lot, and I truly think it is. So I think thinking about, could you actually play in a non-contact league, or in a league that's touch rugby instead of tackle rugby. So just thinking about other options that still enable all the benefits while reducing the risk if you're choosing to retire from that specific sport. But really important to have that discussion with your healthcare team and to think about all the different options. And I think the other thing I would say is concussions are a treatable injury. So have you fully rehabilitated? So really make sure that there's recovery as best we can detect currently, and making sure that you look at the gradual reintroduction of physical activity. And I still see in the clinic many people that haven't followed the basic principles of what we recommend in the return to sport strategy. And in many cases, there are areas that actually could respond really well to treatment, and people still have these ongoing symptoms, but actually they're very treatable. So making sure to address all the different pieces so that you can function as best you can, and you've treated all the pieces that could be amenable to treatment.
So you mentioned you see individuals coming into the clinic who haven't followed the steps. If someone's on a team, how well equipped are most coaches to ensure a player is following through so they are ready to return to sport?
So it's a really good question. And I think, we ask a lot of coaches, and coaches have so much on their plate, and often at a grassroots level, especially they're volunteer coaches. So variably, coaches have quite variable knowledge in this area. We did a few years ago after our fifth international conference. We worked with Hockey Calgary, and they actually printed the concussion recognition tool on the back of clipboards to help coaches detect a concussion. So thinking of strategies that could be helpful that way. And then one thing that we learned in our study looking at implementation was that people really wanted help with communication between groups. And so we developed a communication tool that actually lists the different steps of the return to sport and the return to school strategies. And the feedback that we've had is that that's been really helpful in terms of understanding where people are. So it's a tool to help with communication, but it also helps with education and helping people learn. So I think it's that lived experience of managing concussions in a specific setting. So not everyone has the same knowledge, but hopefully over time we're getting better and better knowledge and helping to spread the word around concussions.
Yeah, I love that what Hockey Calgary did. I feel like that should just be part of any high impact sport, is making sure that coaches are well versed in recognizing concussion, but also understanding the recovery process to ensure an athlete isn't returning too fast, because lots of risk factors if you return too early, and you've mentioned a lot of them already. So
yeah, and a lot of the time in the Canadian guidelines, there is a letter, a clearance letter, medical clearance letter that they require prior to someone coming back. And that is one step in terms of optimizing safety from a return standpoint. There are challenges, though, in terms of access to care and having those letters completed. So that's a bit of an ongoing challenge, but I think in time, hopefully we can look at new and novel ways to help facilitate that process. But ultimately, safety is the most important piece.
Well, Catherine, thank you so much. This has been very insightful. And I think for myself personally as a mom, so many things to watch out for. And I'm sure that everyone listening today is probably taking away some great nuggets around, how to better watch out for concussions or just what it involves for the recovery journey. So just really appreciate having you join us today, and excited to see what new research comes out around concussion.
Well, thank you so much, Jen. Happy to share. And I'm also very excited. We have lots of different studies on the go. So I think in the next 10 years, it'll be very exciting to see the direction that the concussion field takes in terms of better understanding a lot of the things that we've had great advances on in the last 20 years, but we still have so much to learn. So perhaps I can visit the podcast show again with an update in the future.
Thanks so much for joining us today. We had a great conversation with Catherine around all things concussion management. If you're interested in learning more about physiotherapy or to find a physiotherapist near you, visit albertaphysio.com. See you next time.